Did you know that diabetes affects over 500 million people worldwide and is one of the leading causes of death and disability? Even more alarming is the fact that millions are living with diabetes right now without even knowing it. Diabetes often develops silently, showing subtle signs that are easy to overlook or dismiss. These symptoms are your body's way of sounding the alarm. Ignoring them could mean allowing this dangerous condition to progress unchecked, leading to serious complications like heart disease, kidney failure, and even blindness. In this video, I'm going to reveal 9 warning signs that could indicate diabetes is closer than you think. Stick with me because I'll also explain how to take action if you recognize any of these symptoms, potentially saving yourself or someone you love from serious health risks. Before we dive in, take a moment to like this video, subscribe to the channel, and turn on the notification bell so you never miss life-saving health tips like these. It's time to take your health into your own hands. What is diabetes and why does it matter? Diabetes is a condition that disrupts how your body processes sugar, the primary source of energy. Insulin, a crucial hormone, helps move sugar from your blood into your cells. When this process fails, either due to insufficient insulin production or your body's resistance to it, sugar builds up in the blood, causing widespread damage. Excess sugar in the bloodstream harms nerves, blood vessels, and vital organs. Over time, this can lead to severe complications like heart disease, kidney failure, and vision loss. Type 1 diabetes is an autoimmune disorder where the body attacks insulin-producing cells, while type 2 diabetes, far more common, develops from factors like poor diet, inactivity, and obesity. The warning signs of diabetes often appear subtle, but recognizing them early can prevent devastating outcomes. Watch closely for these symptoms. Your body may already be sending you signals. Excessive thirst and frequent urination. One of the earliest and most common warning signs of diabetes is feeling constantly thirsty and needing to urinate more frequently than usual. This happens because high blood sugar forces your kidneys to work overtime to filter and remove the excess glucose from your blood. As a result, your body loses more water, leaving you dehydrated and triggering an unquenchable thirst. The cycle doesn't stop there. Drinking more water leads to even more trips to the bathroom, especially at night, which can disrupt your sleep and leave you feeling exhausted during the day. Many people dismiss this as simply drinking too much water, but when paired with other symptoms, it's a red flag that should never be ignored. If you find yourself drinking far more water than usual and still feeling thirsty, or waking up multiple times a night to urinate, this could be a sign that your blood sugar levels are dangerously high. Unexplained weight loss. Losing weight without trying might seem like a good thing, but it's one of the most concerning signs of diabetes. When your body can't properly use sugar for energy due to low insulin levels or insulin resistance, it starts breaking down fat and muscle instead. This process causes rapid, unintentional weight loss, even if you're eating normally, or in some cases, more than usual. This symptom is most common in type 1 diabetes, but can also appear in advanced cases of type 2 diabetes. The weight loss isn't healthy. It's a sign that your body is struggling to find fuel to function properly. Along with weight loss, you might notice feelings of extreme fatigue or weakness as your body isn't getting the energy it needs. If you've noticed the numbers on the scale dropping for no clear reason, it's not something to ignore. This could be a sign that your body is signaling serious trouble. Constant fatigue and weakness. Feeling tired all the time, even after a full night's sleep, can be a major warning sign of diabetes. When your body can't use glucose properly for energy, it leaves your cells starved, making you feel constantly drained. This persistent fatigue isn't the kind you can fix with coffee or a quick nap. It's deep, unrelenting exhaustion. High blood sugar also thickens your blood, making it harder for your heart to pump oxygen and nutrients to your muscles and organs. This lack of proper circulation compounds the feelings of weakness and lethargy, leaving you struggling to complete even simple tasks. If you're finding it harder to get through your day without feeling utterly exhausted, or if physical activity feels unusually difficult, your body might be alerting you to a deeper problem. Fatigue tied to diabetes is a signal that your energy systems are failing, and it shouldn't be ignored. Blurred vision. Blurred vision is a symptom many people overlook, but it can be an early indicator of diabetes. High blood sugar causes the lenses in your eyes to swell, altering their shape and making it harder to focus. This can result in blurry or distorted vision, which may come and go depending on your blood sugar levels. Over time, consistently high blood sugar can damage the tiny blood vessels in the retina, leading to a more serious condition known as diabetic retinopathy. If left untreated, this can cause permanent vision loss. If you've noticed changes in your eyesight, whether it's trouble reading, difficulty focusing, or persistent blurriness, it's not something to brush off. Your eyes could be reflecting a bigger issue happening inside your body. Slow healing of wounds and frequent infections. If cuts, bruises, or wounds seem to take forever to heal, it could be a sign that diabetes is interfering with your body's natural repair processes. High blood sugar affects your circulation, reducing the flow of oxygen and nutrients to damaged tissues. Without these essential resources, the healing process slows down dramatically. Additionally, elevated blood sugar weakens your immune system, making it harder for your body to fight off infections. This is why people with undiagnosed or poorly managed diabetes often experience frequent infections, particularly in the skin, gums, or urinary tract. Pay attention to wounds that stay open for weeks, recurring infections, or even minor injuries that don't heal as they should. These aren't just surface-level problems. They're signals that your body's systems are being compromised. Tingling or numbness in hands and feet. A persistent tingling sensation or numbness in your hands and feet is a warning sign you should never ignore. This symptom, known as peripheral neuropathy, occurs when high blood sugar damages the nerves, particularly in your extremities. The sensation often starts subtly, with a slight tingling or burning feeling, but it can progress to numbness or even sharp, shooting pains. Left unchecked, nerve damage can become permanent, leading to significant discomfort and reduced mobility. This symptom is a clear indicator that diabetes may already be affecting your nervous system, even if other signs seem mild. It's your body's way of signaling that something serious is happening beneath the surface. Increased hunger, even after eating. Feeling constantly hungry, even after finishing a meal, could be a sign that your body isn't processing glucose effectively. When your cells can't absorb glucose due to insulin resistance or insufficient insulin production, they signal your brain that they're starving. This results in frequent hunger pangs, even if you've just eaten a large meal. This excessive hunger, known as polyphagia, doesn't just lead to overeating, it also contributes to weight fluctuations and worsens blood sugar control. The more you eat without addressing the root cause, the more glucose builds up in your bloodstream, creating a dangerous cycle. If your appetite feels out of control, or you're constantly craving food. Despite eating regularly, it's a warning sign that your body's energy systems are malfunctioning. Dark patches of skin. Unusual. Dark patches of skin, especially in areas like the neck, armpits, or groin, can be an early indicator of diabetes. This condition, called acanthosis nigricans, occurs when high levels of insulin in the blood stimulate the skin cells to grow rapidly, causing thickened, velvety discoloration. These patches may appear suddenly and are often mistaken for dirt or poor hygiene. They can also feel slightly raised or have a different texture compared to the surrounding skin. While acanthosis nigricans itself isn't harmful, it's a clear sign of insulin resistance, a precursor to type 2 diabetes. If you've noticed darkened skin in folds or creases of your body, it's crucial to take this symptom seriously. It's not just a cosmetic concern, it's a warning that your body is struggling to manage blood sugar levels. Frequent yeast infections. Frequent yeast infections can be a surprising but important warning sign of diabetes. High blood sugar creates the ideal environment for yeast to grow, leading to recurring infections, particularly in warm and moist areas of the body. In men, these infections often occur in the genital area, causing symptoms such as itching, redness, swelling, and discomfort. In some cases, a white, clumpy substance may appear under the foreskin or on the affected skin. Thrush, another type of yeast infection, can develop in the mouth, leading to soreness, white patches, and difficulty swallowing. If these infections occur repeatedly or are hard to treat, it could indicate that elevated glucose levels are weakening your immune system and fueling yeast overgrowth. Recognizing the early warning signs of diabetes can make all the difference in preventing serious complications. Symptoms like excessive thirst, frequent urination, unexplained weight loss, constant fatigue, blurred vision, slow healing wounds, numbness in extremities, increased hunger, dark patches of skin, and recurring yeast infections are your body's way of alerting you to a potential problem. If you've noticed any of these signs, don't ignore them. Schedule a checkup with your doctor and request a blood sugar test. Early diagnosis and management are critical to reversing prediabetes or controlling diabetes effectively. To reduce your risk, focus on making healthier lifestyle choices. Maintain a balanced diet rich in whole foods and low in refined sugars. Stay physically active with regular exercise to improve insulin sensitivity. Monitor your weight and maintain a healthy BMI. Stay hydrated and avoid sugary beverages. Get regular checkups to keep track of your blood sugar levels. Your health is in your hands. Pay attention to your body, take action early, and share this information with others who may benefit. Don't forget to like this video, subscribe to the channel, and let us know in the comments if this helped you or someone you care about. Take control now, because your health is worth it.